We will never know how many friends and family didn't get COVID-19 because we followed safeguards. We'll never know that number. We'll never know how many lives we saved because we wear masks, wash our hands, and keep our distance. We'll never know exactly who we help when we take protective steps each day. We'll only know that we did all we could to save people from a dangerous pandemic. And that's a nice thing for us to live with. Together, we are beating COVID-19.
Amish. People ask me, why'd you move out there? Because of a boy. It's my husband's fault. But I have been a registered nurse since 1989. I went to school at Temple, graduated with my baccalaureate in 89, started at Jefferson. I've worked at Hahnemann, Jersey Shore. I've worked mostly open heart ICU, most of my career in CTIC. And then I was a manager for 4 or 5 years. I was a nurse manager. Part of it was at Hahnemann. And then I left nursing for like a year and I came back to the bedside because I missed it.
Oh.
So right now, I am working 2 jobs. I work for WellSpan Health System. I am at Ephrata in the recovery room in the PACU, recovering patients post-operative, all kinds of surgeries. I used to work at York in the CCU there, but I also work right now for Penn Medicine, PA College of Health Sciences, and I'm adjunct faculty for clinical. So I teach clinical for nursing students.
Oh, wow. That's awesome. Have you ever heard of NAHN, National Association of Hispanic Nurses?
Well, funny you say that. I was one of the original founders with Valerie and Blanca and Juanita, all of them back in the late 90s. Yeah.
Oh, wow. Congratulations. I didn't know that. I mean, I wasn't sure who all were the founders, but that's awesome. I'm so glad that we have one of the founders on here today. So
I never sat on the board because I was always so busy. That was Valerie and Marisol and Juanita and Blanca and all them, but I was one of the original members.
That's awesome. That's awesome. Cookie is one of my very good friends.
Oh, nice.
Yeah. Brunilda Sanchez, another nurse, one of my favorite nurses. So this year, 2020, and this pandemic, how has it been for you as a nurse and watching, people coming in over and over and over again? How has it been for you?
Well, in March, I went into the ICU. Beginning of April. So for a couple of months, I offered to go into the ICU because we needed to help out in the other units. And I was taking care of quite a few patients. And it's been very stressful, emotionally, mentally taxing. When you watch somebody take their last breaths and their loved ones are not there, it's really sad. It breaks your heart. It breaks your heart.
Wow. That's I didn't expect you to say that. I just felt every emotion in that, and I envisioned that person taking that last breath. That was very deep.
And by themselves, that's the worst thing. We as Hispanics, we're very family oriented, and watching this, it was heartbreaking. We were using the Zoom iPad and we would use our own phone so that they could talk to their families. Yeah.
That was the hardest part for people, is not knowing what was happening day to day, and sometimes not being able to speak, because unless you have a nurse or a healthcare giver that was empathetic enough to say, I know you want to talk to someone, I know you want to see someone, maybe this will help your recovery. But at the same time, it's dealing with that that the end, and not knowing when the end was. But then there's that second piece of it, the not being able to have an appropriate burial, and when someone
Yeah.
passed, that was
Yep.
the other piece of it. People were being refrigerated, kept in. Can you explain like what was the process? So let's say, for example, give us without, of course, naming names because of HIPAA. And I know you know all of that. Give us like one of your worst cases that you kind of saw from beginning to end, if you could remember anything.
One of my most emotional cases during this COVID thing, and he was Latino. Apparently, his son came from New York to help him move. And this is before the outbreak was known. This fue en marzo, marzo, abril, around there. His son came down from New York because el viejito and his wife were going to move into their daughter's house with her husband because they were getting older. Well, the son that came from New York didn't. He was asymptomatic with COVID, and the whole entire family got COVID. His daughter's husband, his son-in-law died. His son died. His wife ended up going to Florida so that the other child could care for her. And he was fighting for his life. Yeah. And his daughter was still in the hospital at that time, but God willing, she was discharged. That was very emotional.
Wow.
Yeah.
His son died.
His son died and his son-in-law.
His son-in-law.
And his daughter was in the hospital.
His daughter was in the hospital, and he's still alive, but has to live with that guilt for the rest of his life.
Yeah.
That's probably one of the hardest things. Death is hard enough, but then dealing with, as
Yeah.
and no fault of his own. He didn't know what he didn't know. That's
He
no
didn't
fault of his
know.
own. You can't fault someone who doesn't know. It's different when it's knowingly and you participate in something, but when you don't know, you just don't know, and you're wow. That's hard.
That was emotional for me because that was like, wow.
And so
for myself, I'm just starting to get over COVID myself because I was out for a month from work. This week was my first week back at work.
wow. Thankfully, you survived the COVID. So share with us how did that start? Like, when did that what did
Oh,
how did that start for you?
and I even have a lot of guilt with it because my husband and I went to a party that weekend with just a couple friends, and knowing we were asymptomatic. So what I'm seeing is a lot of times you are most contagious when you're asymptomatic, not even knowing.
Mm-hmm.
So my husband's a DJ on the side. We were DJing. I didn't have a good feeling about it. And I kept telling him, and Dito, he feels bad. But Friday we worked, and then Saturday we went to a friend's house. Sunday we went to his friend's house to watch the football game. Monday I started feeling like I had a sinus infection. I did not have the high fever. I did not have the coughing at first. I had sinuses. So for me, it was just nasal congestion. It's that change of weather. I'm like, I always suffer from sinus infections. I'm half deaf because of all the sinus infections. I'm like, what'd you say? From all the years of having them. So yo creía que I had a sinus infection. So all week I'm taking NyQuil and Sudafed and treating myself. Wednesday, we get the call from one of our friends that his daughter and practically the whole house was testing positive for COVID. That Saturday, I go to another friends in that party too. So I feel extremely guilty because unknowingly, and I'm going to be totally honest, unknowingly, we took it there.
But you didn't know. So forgive yourself. No, forgive you. You have to forgive yourself.
But
you have to forgive yourself.
Yeah. I'm still going to always feel bad about it. But now I'm like, people, be careful. So that Saturday, I'm teaching clinical with my students. We all have to wear masks while wearing goggles. And all of a sudden, around 2:30, I couldn't breathe. I was short of breath. I couldn't catch my breath. When I was speaking, I had to speak really low because the whole day I was running from 3 ICUs, because I had 4 students in every ICU. So here I'm talking to one of my students and I could not catch my breath. De momento, it happened like that. So all of a sudden I said, oh my God. So as soon as we got done at 3, I went straight to the urgent care. I was not moving a lot of air. They threw everything at me, a Medrol, a Z-Pack, another antibiotic. They gave me an inhaler and did a chest x-ray. I went home and collapsed. Sunday, I'm just laying in bed, just chilling out, and I'm really fatigued. That afternoon, I got the call early evening. I got the call that I was positive for COVID. Monday, I had absolutely no energy. I lost my taste of smell, lost my taste. Like I lost my sense of smell and my taste. And I still don't have it all completely back. My sense of smell is only a little bit. My taste, a little bit. It's not back yet. By Monday, Tuesday, I was in bed, fatigued. And then Wednesday, I was coughing. The cough started up and I couldn't catch my breath. The inhaler, I couldn't even get the inhaler in. So my son took me to the hospital. They gave me a nebulizer. They did a CAT scan of my chest because with this COVID, it causes blood clots. It does something to your blood that causes you to have blood clots. So they did a CAT scan of my chest to make sure I didn't have a pulmonary embolism, a blood clot in my chest. And that was negative. But because they gave me the nebulizer, the albuterol treatment, I was able to move some air. Thursday, I was sleeping a lot, coughing a lot. Friday, I woke up and I could not catch my breath. My son came running into my room and, my husband was home too, but he was downstairs. My son came running in. He was like, what the hell? You can't even breathe, El. You can't even breathe, Mommy. I could not breathe. I couldn't catch my breath. My pulse ox was 88. So I came to the hospital. I had a friend who was a hospitalist where I work, and she admitted me, and the pulmonologist started me a remdesivir, which is one of the medications. It doesn't cure the COVID. What it does, it helps shorten the symptoms of it.
It shortens it. Okay.
It helps shorten it. You get 5 days, give or take. They were giving me 5 days of it. So, but in the hospital, it was hard. I cried because it hurt. My symptoms, and everybody's symptoms are very different. Some people have very high fevers for days on end. I didn't have high fevers. I had low-grade fevers here and there. Mine was congestion. I had a massive migraine, muscle pains. I couldn't catch my breath. I had a very tight cough. It was non-productive. It was just super, super tight. A little different from asthma, but just very tight and very fatigued.
Do you know why it causes the headaches?
Not really sure. And they're still figuring out what all the symptoms are because as COVID comes along, I've talked to many clinicians and they say it's constantly changing. And they've been finding lately, excuse me, they've been finding lately that congestion is one of the signs, and they never thought of that before.
Like upper congestion or congestion anywhere?
Upper congestion. It feels like your eyes are, you know how when you have a sinus infection or sinus headache?
Yeah.
That's what it feels like.
That's the worst. I've had sinus headaches and sinus infections. I haven't had one, but I remember one time I had 6 sinus infections in one summer.
Ugh.
And it was because I was around people that smoke cigarettes. So that is one of my triggers.
Oh, yeah.
But going back to you being in the hospital, because I think that's where you left off. You were in the hospital, right? And that's when they were giving you all those medications and they were taking
medications. I had pain medication for my pain in my back. And it was not just Tylenol. It was a strong one. And then I was getting albuterol nebulizers every couple hours. I was on oxygen. Just walking to the bathroom, I would get winded. Even now, just walking a distance, I still get winded. They put me on steroids. They threw everything at me. By day 4 of the remdesivir is when I started to turn around. I went home on oxygen. I was discharged on oxygen.
You were discharged on oxygen. How much oxygen did you have to?
I was on 2 liters.
2 liters.
And I was able to wean off during the day and just use a half a liter to 1 liter at night. They even gave me Hydrocant, which is hydromorphone, and it has something else in it for coughing because my cough was so bad.
Did it hurt everywhere when you coughed?
Oh my God, did it hurt? Yeah, it did.
Wow.
It did. You know, all I can say is, unless you actually see it or experience it, you kind of think, people exaggerating. Exagerando. That's what you think. No, I can tell you it's not. This crap is real. And the hospitals, I can tell you, are really. My son works at LGH, and this past weekend on both ICUs, I could tell you half of the unit was full of COVID patients.
And when you unfortunately got it, how many people also got
From us?
Yeah.
1, 2, 3, 4, 5, 6, 7, 8 people.
Because you had the party and then you also had the football gathering.
So collectively, about 7 people, 7 or 8 people.
7 or 8 people. And is everybody okay?
Thank God, yes. One of his friends, he's like me, where he's still having a little trouble.
Yeah. Do you find that that people are more severe when they have underlying issues, or does it even matter?
I have no underlying issues, none. Which is the crazy thing. I don't have a history of asthma. Only thing that happens to me is when I get that sinus infection from the postnasal drip, I get bronchitis.
Yeah.
That's it. I have no underlying conditions.
Now,
but with underlying conditions like diabetes and asthma, they get it worse, especially with asthma, with the lungs. Yeah. And diabetes does a havoc in your body. So your body's already weak enough.
So do you know if you have any lung damage?
No, I don't. We don't know yet.
Okay.
They're still doing a lot of studies to see what the long-term effects, and they call it like the I forget what the name is. I think it's the long haulers. Mm-hmm. Those of us that really take a long time to heal from it. My husband had it for 2 days. He had mild symptoms. My son was completely asymptomatic. Thank God. And then his son was negative. So he moved out of the house. He moved to a friend's house for a couple weeks. And he took a test to come back to make sure he was negative when he moved back. Yeah. So we all responded different to it.
Yeah, that's true. Everybody responds differently to it, and that's why you're saying they're still collecting data and doing research on all the different symptoms, and everyone has it differently. And then you have the ones that are asymptomatic. If you could offer some advice to the people out there in reference to being careful. I know some people don't think it's real. It's real. But what kind of advice would you offer to the people out there about, playing it safe, being healthy, trying not to catch it, or if they do catch it?
Listen to the medical experts that are telling you, like Dr. Fauci. He saw this coming. This is what he does for a living. And all those medical experts, they've been saying it for the longest time. My Thanksgiving is going to be at home with those I live with. My mom last night, I was talking to her on the phone. I was like, Mommy, don't go Primo's house. I mean, I know you do that every year. She felt bad. Bendito. I feel bad. We always do this. I said, Mommy, no te vaya. Don't go. So she's going to not go. I said, Mommy, your health is more important. Stay at home. Stay at home.
How old is your mom?
She'd kill me if I tell you. But she's in her early 80s and doesn't look like it.
She's blessed.
She's very blessed. Bendito, mommy was so worried when they saw me. Victor was on the phone, my brother, with me the morning I had to go in. And my brother was like looking at me. My mom just started crying. My brother, he can usually look at me. He says, "You're not feeling well. You're green." I'm like, "Gee, thanks."
And you were at the hospital when
this is before, when I was on video chatting with them, that I answered because they were worried about me. And when they looked at me, my brother's face, you could see it. He was faking it, but you could see it. And my mother just started crying because I was pale. I couldn't cough. I couldn't catch my breath. I kept coughing. Yeah, they were scared.
Okay.
But I would offer people to be very careful. Okay. Continue with the mask, hand sanitizing, take lots of vitamins, citrus juices, fruits, especially, by all means.
What kind of vitamins do you recommend for the people?
Just regular multivitamin and vitamin C. I would recommend a lot of orange juice.
I saw somewhere I saw some article that talked about people that were coming in that were like vitamin D deficient.
Mhm. Yeah.
Yeah.
But if you take a multivitamin, it has a little bit of everything. But if you drink citrus juices, fresh orange juice has a ton of vitamins, fruits. There you go. You know, when I went into the hospital, oh, also something else. You know, there are certain levels that they check when you have COVID to see how bad the infection is. It also causes clotting. For me, it showed that my D dimer, which is one of the clotting factors, is elevated. I've had a hysterectomy in 2004. I've been on hormone therapy all that time. They had to take me off because of the high risk of clotting.
Oh.
So on top of that, I'm in menopause.
Were you being a monster? Were your emotions all over the place?
Girl, all over the place. All over the place. And you know what was really the hardest? Being in the hospital by myself. I was in that room, isolation, and I could tell you the nurses were fantastic. Doctors were fantastic. But you're alone. You are by yourself. It was emotionally taxing.
How
You
do
know,
they take care of you? So I know you're by yourself. I know they put all the stuff on to bring you food. Like, are they still bringing you food? Are they still giving you medication? Like, they're still doing their cycle. Like, what's it like to be in the hospital?
it's very lonely. I mean, the nurses were fantastic. You know, they were always checking on me, but when they come in, they were completely garbed up with their N95, a lot of times with the hairnet, because I was in the section with COVID patients and they put the gown on. So when I go in to see a COVID patient, it's all kinds of garb that you're putting on. You put your N95 and then on top of the N95, you're putting a surgical mask and goggles.
Did you have your cell phone?
Yes. Oh,
And
that was a
your charger?
lifeline.
And your charger?
Oh, heck yeah. I almost forgot that when I was getting ready to go to the hospital. As soon as I go out the door, my son's like, "You have your charger?" I was like, "Crap."
Yeah, because at the end of the day, if you have your phone, it's one thing, but if you don't have your charger, I remember a friend that I grew up with since I was 8 years old. She did get COVID. She was isolated at home. She was, in a room, and then eventually had to be hospitalized. And they actually put her. She was on, she was on breathing tube, but she was actually on oxygen, and she was communicating with us on Facebook Live. But they were telling her, take you know take a break. You need your lungs, you need your air.
Yeah.
um, she wanted to keep us abreast of what was going on. And then I remember one time she's putting on Facebook, "I forgot my charger. If anyone, please, if anyone that's my friend now, can bring my charger, my husband will put it in the mailbox." Her husband was at home taking care of the little kids, so he couldn't do it. Or didn't do it, or maybe they had to stay isolated also because she was in that household. But someone that we grew up with actually went to her house, picked it up from the mailbox, and dropped it off to the hospital so that she could have.
Yeah. I didn't even talk on the phone. Most of the time, I was texting because I didn't have the breath to talk. It would just wake me out. So I was texting for like 2 weeks. I was barely on the phone.
Yeah, I have also a coworker who her mother just recently was released from the hospital, but she was so worried. My girlfriend was so worried about her mother that I thought she was going to have a heart attack. And I said, "Listen, I know that you're trying to reach your mother and she's not responding. But when people have COVID, they need their energy. They need their lungs. They can't talk to you. They need their energy because they're fatigued." I said, "What about trying to call her nurse?" That department, she was able to reach a nurse, And I felt like she was so relieved because she was told that her mom was fine, that they are giving her oxygen, but that she's, trying to work on just being calm and just, being healthy. So she felt relieved, but I'm like, you have to stop worrying because your mother needs your strength. So if she knows that you're worrying and that you're panicking, that's going to prevent her from getting better. So, so we have to help others think that way. Like you can't panic because, it's easier said than done, but you have to stop panicking or let others know that you're so worried about them because then that prevents them from getting healthy because they're worried about you. I grew up around another man. His name is Eric. He and his mother and I grew up around them. He and his mother were in the hospital at the same time with COVID.
Ugh.
And they died 2 days apart.
Oh my God.
So that was devastating for the town that I grew up in. Devastating. Devastating because this is someone that we knew as a happy person, always speaking to everyone, and he loved his mother to death. I don't remember that they told him that she died. I think they told him that she had a heart attack. But I was like, I hope they didn't tell him that she died because, of course, even telling him that she had a heart attack was going to prevent him from getting better because he was so worried. So, that's, I know it's easier said than done, but we have to ensure to try to calm people down so that they can help others get better.
Oh, trust me, as a nurse, that's what we do. Inside, I'd be like, holy crap. Meanwhile, I'm faking the funk.
Yes. And that's why we need, amazing nurses like yourself who's been in the field 30 plus years. And you said you wanted to go back to the ICU in March. I commend you and thank you from the bottom of my heart for being that first responder. Like that is so special. I get emotional because it is so special. And I thank you. Like that's amazing. Like, thank you.
It's crazy. As a nurse, you don't even think about it. It's what we do. It's a thankless job. And I always tell my students too, listen, if you're going into this profession thinking you're going to get a pat in the back, it ain't happening. You're not going to get it. But when you least expect it is when all of a sudden you just get a look from a patient or you get a little thing, just those little things. It comes a long way. It really does. That's why we're doing it.
But how do you guys stay? It could be, debilitating. It could be mentally stressful, but how do you cope? How do you cope and help each other as nurses or people in the health field?
We do help each other a lot. We talk a lot. We debrief a lot. A lot of times, if you have a patient that you're very close to and you lose that patient, we talk to each other a lot. And you know what? Most nurses are very spiritual. God knows what he's doing. It's God's way. There's no logic to it. You don't try to make logic out of it. You do the best you can. And when that time comes, you're like, it was God's will. And you have to learn to detach when you leave the hospital. It's one of the hardest things to learn to do. But most of it is all spiritualism.
So is that how you do it? So when you leave the hospital,
you try not to think about it. Some patients are on your mind, but for the most part, you leave it in God's hands.
So are there things that you're doing differently now in terms of since you've had COVID that you may not have been doing before to ensure you don't, I'm not sure if you think you got it from the hospital or from wherever, but of course the probability is higher than none because you're there. But is there anything you're doing different in terms of your sanitizing styles or anything right now that you're doing different to make sure that you're trying to prevent or?
What's crazy in the house? I used to leave the sanitizer somewhere else. Oh, I have it in the living room around the table. I have another one in the kitchen. My boys are using it. My husband's using it. Everyone really didn't think about it.
Yeah. It's like second nature now. But so they're saying after you get it, right? They're also saying that you shouldn't retest until maybe 3 months later because it can still come up that you have it because of antibodies, or why are they saying that?
And it's because he will test positive because he still have the antibodies.
Still have the.
I'm thinking months out. Once I do heal from this, I am going to donate blood for convalescent plasma.
For what? Sorry, for what? You name in terms. Come on, break it down.
Plasma, what it is you give blood. And basically what they do is they take the plasma out. They remove the blood cells, take the plasma, and give the plasma to those that are suffering from COVID that are really severe because it has the antibodies. So they're giving somebody the antibodies to help fight off. I didn't need that because I wasn't bad. And in the ICU, we've given that to patients.
Wow.
So I do intend to give blood in a couple months once I get better because it'll have the antibodies. So somebody else will. What's the word? You get this brain fog from COVID too. You lose your brain cells when you have a kid, and then you get brain fog, and then you turn 50 and all hell breaks loose.
No. As we age, it's true. And, stress also causes brain fog.
Oh, my God.
Sometimes you feel like you're really stuck on stupid. Like it's quote unquote brain fart. It's like, my God, what's going on?
You know what I mean?
I get it. I have a 19-year-old daughter. And when I got pregnant, I'm like, oh, my God, I can't even think of the silliest words. I will sit there and actually start describing something so that it's like playing charade so that they can guess the word so that I can be like, yeah, that's it. That's what I was trying to say.
Your brain cells and you never get them back.
So I heard that brain fog was one of the symptoms too.
Oh, yes, definitely. It's like you're living like in a fog for every once in a while. It's like when you're just waking up and you're not fully awake, kind of that feeling.
Wow, that's pretty interesting.
Yeah, it's crazy. Crazy.
When you were discharged, you no longer had symptoms? I mean, other than your taste and smell, because I know that. How long does that last?
My understanding, it can last for months.
That's horrible.
I've spoken to some people that, like today, there was a smell somewhere, and I was like, I don't smell it. They're like, what? I'm like, I don't smell it. And my tastes are better. I mean, I could taste a little bit. And when I'm cooking, the other day, I was making pollo guisado. I was like, can you guys taste this? I want to make sure that I'll make it to salad.
Yeah, you want to make sure it's not salty, right?
Yeah. I was like, holy crap, I can't taste this. I'm going to keep putting sazon. I'm going to keep putting those kinds of adobo in it.
Wait, who tasted it for you? Your husband? Your son? Who tasted it?
My son.
And it was okay?
He was like, Mom, it's good. He likes to cook, so he's like, it's good. Leave it.
That's great. So, I know that you said, so you graduated from Temple, and you're also a professor?
Adjunct
faculty.
Adjunct faculty, because adjunct faculty is part-time.
Yeah. You're muted.
What to do?
Yeah.
Like I said, I started going to management, and I just always loved precepting and teaching new nurses. So I'm hoping by fall I can start my master's. Because when you're adjunct faculty, I can teach at the associate level, and I have up to 5 years that I can teach without my master's, or I have to be matriculated. I've already decided because as I still love the bedside. So I want to do the best as I'm getting older. I'm 55, and I ain't gonna lie. I'm old. So I'm thinking, as I get my bones, pushing patients, pulling patients, I could do less at the bedside, teach more clinical. I love teaching new nurses. Those are our future nurses.
Ellie, you're not old. Okay. You saying that you're 55 and you're old is very offensive to people. Okay. Old is in the mind. You're not old. You're still rocking and rolling, right?
But let me tell you, I still love my salsa.
You're not old. But in terms of, I know that you mentioned that you had a class that day and you couldn't breathe. Did any student?
No, none of them. The two that I ate lunch with, they were quarantined, and all the students were told. And one of them tested negative. Nobody got it. Because in my mind, I'm thinking I was already out of being contagious.
Yeah.
Yeah. But
Well,
I mean,
they say 10 days.
yeah,
They say 10 days is contagious. They say 10 days from your first symptom.
yes.
10 days from your first symptom in terms of being contagious, correct?
Yeah,
Even though you went to quarantine for 14 days, but it's 10 days from the time you had your first symptom.
and that Monday is when I had my first symptom. So I was already a week in.
Got it. Got it. And so just back to the hospital, when you were there and you were lonely and by yourself, were your family worried and freaking out? And
No, they weren't freaking out because they were texting me. I had a couple cousins reach out to me that were younger that I loved dearly. And they were willing me to death because they were like, you better freaking get out of this. You better kick this,
right,
you know?
right. And you
Yeah.
kicked
I
it.
was so blessed. And I could tell you, when you go through a situation like that, you start thinking, wow, you're not rich by money by any means. Because I am blessed with family and friends that are around and real family and friends. My family was reaching out, and but good friends that are like family.
Yeah.
My coworkers, my one coworker, Laura, she brought in a whole bunch of stuff for me. She brought in perfume and penny liners and all kinds. She brought me in Jolly Ranchers and food that I like so I could at least keep eating. She's one of my closest friends. And then other two coworkers, they knew where my room was. They brought in colored chalk. And outside, they put, "We love you, E."
Oh, that's so sweet.
And they're like, "Elle, just look out the window." I'm like, "What?" "Look out the window." And I looked out the window. There was big on the side on the road. Out the window. Yeah.
So I have a question that just came in, and it's saying, after you have COVID, can you get it back again, or are you immune?
No, there's no such thing as being immune to this. Yes, you can get it again. They're still doing a lot of studies. So yes, I can very easily, or those that have had it, yes, they can get it again.
You can get it, and you can get it again and again and again and again and again.
As far as we know, I mean, there's still so many studies because it's only been a year since COVID's been out.
Yeah, my 19-year-old and her friend seems to think that after you get it, you can't get it again. And I'm like, where did you get that information from?
It's President.
You mean number 45?
Number 45. I'm just going to name you
45, girl. 4 or 5.
Soon to be gone. In his mind, and look what it did to me. Meanwhile, I'm paying attention to all the people we've lost.
So you're really saying, listen to the scientists, listen to science,
listen to the scientists, not to number 45,
and medicine.
The medicine experts, that they're still learning so much, and they're still coming up with stuff, and there are so many studies going on. One of my closest friends is working on a COVID year. She's doing traveling COVID assignments, and she's at Johns Hopkins, and she was talking to me recently about all the studies that they're doing down there. And I was like, wow, that's a good one. Many studies that are still going on with this. There's a lot to learn still. Look at it in 1918 when the influenza was out, the Spanish flu. Now we have a vaccine, but it's not really a vaccine. It's only this, we get it once a year. It can come back. And how many different influenzas are there? There's more than just one.
Yeah.
It's mutated.
Yeah.
Coronavirus is your common cold. This is a whole different mutation that COVID-19 is.
Yeah. So what do you I really brain fog. There was something that you said in reference. What do you think about the new vaccine that they're coming up with? That was my question.
You know what's crazy? At first, I was like, oh, hell no. Because number 45 was like, oh, take it. It's the cure. I've been watching a lot of news and watching the efficacy. I mean, I'm on the fence with it. I am on the fence with it only because of number 45. But the more I watch the medical experts talking about it, now there's a third vaccine that has good efficacy from AstraZeneca. You've got the other two, and now the third one that's coming around.
So it's not Pfizer anymore. So now it's Pfizer, AstraZeneca, and who else? Do you recall?
Begins with Moderna. Moderna. So there's possibly 3 around the corner. Because there's no way one company can make it all for the world.
Absolutely not.
No.
But are they all?
Absolutely, I'll take it because I never want this again.
But are they all the same vaccine, or
one of them? My understanding, and from what I've been educated and really paid attention to, that Moderna and the Pfizer ones are actually have to do more at the RNA level. It's really deep science because they're not getting like influenza. You actually get
RNA. Break it down, girl. Break it down.
RNA. It's like DNA, but it's a little different. You're not actually getting the coronavirus.
Okay.
They're breaking it down so that you're given antigens so that you can fight off COVID-19. I've been paying attention. Trust me. Sanjay Gupta's my favorite.
Yeah. Yeah.
Because he breaks it down.
He's amazing. And I've been watching a lot of CNN.
Yeah, me too.
Guamo keeps it real.
He was my favorite. I have a crush on him. Him and Andrew. Oh.
And his brother, the governor, has done an amazing job.
Love those two because Andrew is about as honest as they get, and so is Chris.
There's nothing like integrity. Like you can respect the truth.
Yeah.
It doesn't matter how harsh it is. Give me the real deal so that I can know how to move forward.
Exactly.
But a lie is something I can never, on any level with anyone, a lie is something I cannot get over. I can get over, I can forgive for me, but I don't respect you,
Nope. And I could tell you in nursing, one of the hardest things that we've had to do as nurses, when we're telling the patient's family, it's not looking good. I'm as brutally honest as they get with my patients and their families because my families and my patients deserve the honest truth.
Absolutely.
I'm not going to take a big, nice picture when, no, it's the quality, not the quantity.
It is the quality, and that's where hospice comes in, and that caring and that empathy and that tender and support, because that process is hard, and unfortunately for those who haven't experienced someone close to them passing, they think they know, but they don't know. And the grieving process is it's never ending, really.
But I could tell you as a nurse, especially in the ICU setting, it is one of the most beautiful moments when you see their family there. And I've had to remove the endotracheal tube, remove the respirator, stop all their drips. But when their family is with them and they're together, they're giving each other love. And they have the passing of their loved one. It's emotionally hard, but they were with them and they were all together. That's one of the most beautiful things. I know it sounds weird, but it is one of the most beautiful things.
No, that is a beautiful thing when you're not, unfortunately, dying alone.
Yes.
So, that matters.
One of the things I wanted to talk about is in nursing. I told you earlier that every ICU that I've ever worked at, I'm usually one of the only Latinas. The only one I was the only Latina originally at Hahnemann until Jolie came and worked. I got her a job, got her, opened the door. She got the job. All I did was tell my boss, listen, she's like me. She's a worker bee. She's a worker Latina, and got some other Latinas. But every unit I've ever worked at, even in the PACU now, and it's sad for me, I'm the only Latina. There's such a low amount of Latina RNs.
There's a shortage. There's a
shortage. There's a shortage of nurses to begin with, but for us to be able to serve our people and take care of our people and understand our culture, it's so nice when I'm talking to my patient in Spanish and they're waking up from surgery and I speak to them in Spanish. They're like,
because they feel comfortable. That's something that I really believe in, whether it's in healthcare like yourself, or if you go to the nearest restaurant or at a school, and anybody from any position, whether they're bringing my water or serving my food, if I know that they're Latino or Latina, whatever you want to call it, Latinx, I address them in our language.
Oh,
And
absolutely.
you see all the barriers, all the walls come down.
Come down real quick.
They come down because it's like, first of all, they're like, oh my God, I thought you were Americana. I'm like, no, soy boricua 100%.
They usually think I'm Italian. My hair is usually always up in a ponytail at work. And I have the European nose and I don't have the Spanish accent. When I flip into Spanish, then all of a sudden, yo creía que era italiana. I'm
Yeah.
like, no, boricua.
Yes, exactly. But I think it's amazing, but you're right. There's a shortage in healthcare as it relates to Latinos.
Yes.
Shortage, even in home care. Shortage.
It's shortage.
And having a bilingual person wherever you go is necessary. It is necessary. I don't know how people function without having anybody in their front end, back end, middle end, wherever you go. There needs to be someone bilingual, especially Spanish as the second language in the United States.
Yeah. Yeah.
So how do you deal with that? Do they bring you over to translate, or do they usually the patients that are Latino?
Well, they always have now effort in a lot of hospitals because the Spanish language it's a second language for most people. So they'll have translators. If it has to do with legal consents, I'm not a translator because my Spanish is secondary.
Yeah.
And I don't feel comfortable doing consents because that's legal.
Yeah, the technical words are something different.
Right. But if every time it's a Spanish patient, they see Spanish speaking, they're like, oh, this one's got Ellie's name on it.
Yeah.
Yeah.
I get it. So let's see if we have any questions coming in. It's time for Q&A. We probably have like 10 more minutes left, if that. I don't see any questions yet. Let me see. No, not yet. Oh yeah, so your background is amazing. What made you get into nursing? That's what I did. Huh?
Sometimes I ask myself, it wasn't like a life event that happened. I don't know what happened. Maybe I was watching General Hospital and I wanted to be like Bobby.
You probably were watching General Hospital. It came on at 3.
Are you kidding? But it was the best decision I ever made. Best decision. And my son, and those from the early ones all know him because he was able to get a scholarship. Val hooked him up so that, Val and Blanca, they all got to see my baby because we all started in the late 90s and then he went into nursing and he even said in his speech, he started originally to be a middle school science teacher. And then his sophomore year, he called me up. Something happened. He's like, Mommy, he still calls me Mommy. Mommy, I decided what I want to do. I want to go into nursing. And he loves it. He said, oh, I studied medicine and he loves it. It's when I was a manager, I would interview and say, what made you go into nursing? Because you can teach skills. You cannot teach compassion or what's in the heart.
Nope, that's innate in someone. You cannot teach compassion. You can't teach empathy. No. That's going to be inside you.
And do I love it? Absolutely. Are there some days I'm like, what the hell was I thinking? But it's any job, It's any job. But I do love our profession. Do love it.
That's awesome. That's awesome. Have you ever run across a nurse that didn't share the compassion that you believe they had?
Absolutely.
How do you deal with that?
You know what? It's kind of difficult, especially when they're dealing with patients. Sometimes you go in after them and just talk to the patient, make them feel more comfortable. But yeah, I've dealt with nurses where you see that and it's sad. It really is sad. To tell you the truth, I really don't make time for them. Because the older I get, the less patience I have, because it's about the patient. Because that's somebody's mother, father, sister, brother. That's how I've always treated my patients, and that's my belief.
Exactly. The customer, the patient care and the experience is so important wherever you go.
And it's not just RNs. When I had nursing assistants, they would think, I'm just a nursing assistant. No. It's just a nursing assistant. You're second eyes. I had monitor techs at Hahnemann. They're like, we're just techs. I'm like, no, you're the nurses under eyes.
Yeah.
Mm-hmm. It takes a tribe.
It does take a tribe. It does take a tribe. So we're about finishing up in a few minutes, but is there any like last minute tidbits? I mean, we still have a few more minutes, but just any tidbits that you want to share, from someone who's a Philly John, lives in Lancaster, 30 plus years in nursing, loves what she does, very experienced, a family woman, a Latina. Um, any tidbits that you can share, how people should maybe view their life moving forward. 'Cause after this experience in 2020 has been a whirlwind. We're in a time zone, because I'm really big, like people should live their life like it's their last day because time is not guaranteed.
And
So
tomorrow's not promised.
tomorrow isn't promised. So what
Nope.
would you, if you had to share with people, like some advice, what could you share? I know you said time isn't, I mean, tomorrow isn't promised. It's true.
Tomorrow isn't promised. Family's very important to me. My stepchildren, they're my babies too. They're in their 20s, but I treat them like they're my kids. My husband, I'm like family first. I know we always get caught up in being busy. Family comes first. We got to check up on our parents. We got to check up on our cousins. And again, I still love my job. And we would always, how we're so used to go, go, go. You're a career woman. You just go, 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 go. But this year has really emotionally opened my eyes. Has it to you?
Oh yeah, I think emotionally, psychologically, but for me, psychologically, it's really thinking about and emotionally, what's important for me today? What's important for me today?
Yeah.
How should I maybe should be living my life differently if I need to, or how should I not? And what I've experienced more this year than any year in my life is that I spend more time with myself for my own mental health. I enjoy doing nothing but sitting in a house. I love to cook. So when I get stressed out, I start cooking and I make meals and I start, planning my meal planning. And then I sit down and I watch and I binge watch television and I laugh and I cry and I love every minute of it. And what I decided is I will no longer allow people to steal my time, my peace from me. I won't do it.
Mm-mm.
So I have a 19-year-old. She's the only person that I don't mind picking up her phone call. She will text me at 2, 3 o'clock in the morning. And it'll be the silliest question like, hey, mom, I was thinking about this. And I'm thinking to myself, do you not know I am sleeping? But if I have her on emergency bystand kind of call, like it's going to ring me whether my ringer's off or not. But I'm a mother, so I need to be alert. So if she's texting me or calling me, I'm like, it's important. Even though sometimes it's just to ask me a question because she's up and I'm asleep. So I let but my peace is so important to me. So I don't care who's calling me or texting me. If I don't feel like it is a positive experience, I'm not doing it.
Yeah, it's funny you should say this because as a nurse, and my personality, you take care of everybody else. Your mom, you take care of everybody else. And nurses are notorious for not taking. We don't self-care. And we're all now self-care. You got to take care of yourself because you can't take care of number 2, 3, 4, 5, 6 if number 1 is not taken care of.
Yeah, so that's true. And so the reason why, but what changed my life was really last year and then COVID. But I lost my mother last year on my birthday.
Oh, I'm sorry.
Thank you. And she died of pulmonary fibrosis of the lungs, waiting for lung transplant. She would not have survived COVID.
No,
she would
wouldn't.
not have survived.
No.
So, God called her early because he knew this was coming. She would not have survived. But it was, I've been grieving for the last 2 years, but taking my time with it. And time is everything to me. So, everybody disturbed her peace. And I know that she would want me not to allow people to disturb mine. She wants me to continue to be in that empathetic, helping, passionate person that I am, because I will help people. And if I see someone crying, I'm crying. That's just who I am. And she was the same way. But if I could give people advices, like you said, self-care. Because if I'm not okay, I'm not going to be okay for my daughter. She has seen me go through it for the last 2 years. So, she's been very supportive, and she's grown up through the process, and her second year Rowan student. But, I've appreciated the support of the people that I've had in my life, my friends, my family, and they've given me time to grieve. And it's going to be a forever thing, but more manageable.
Yeah, definitely.
So I think that we are ending here, but you know what? I thank you so much. This has been very revealing, a great experience. I commend you for staying in healthcare and really appreciating, your lifestyle, your work, the things you do, and sharing this opportunity with us, and your story of who you are, where you come from, and your COVID experience. And I give thanks to God that you're alive and still here with us, and everybody else that that is still here with us, and your friends, that everyone survived. And thank you for taking time to meet with us here at El Sol Latino. I'm Lacey G. You have any last minute words that you want to say in reference to maybe Thanksgiving that's coming up? Any advice for that?
Oh, the same thing the guys are saying. Don't meet with a lot of people. Keep it really tiny to those that you live with. Okay? And be really smart about it. Even though, Christmas, we canceled our Christmas with our family, all our cousins, because of what's going on. The older cousins are older. We don't want to expose anybody. Next year. We got next Christmas. We'll hook it up.
Yeah, people have been saying, Thanksgiving is canceled, Christmas is canceled. And I said, no, it's not canceled. It's what you make it. If it's 2 people, if it's 1 person, if it's 3 people, and you're sharing a meal, give thanks that you are here today. It's not canceled. It's what you make it.
It is what you make of it. I intend to Zoom, to video my mom so she can, because she wanted to go to her cousin. I was like, no, quédate en casa. Stay at home. So that she doesn't feel guilty. So in my house, it's just going to be us and my stepkids.
It's the new normal, Ellie. It's the new normal.
That's it. It's the new normal. I just want everybody to know that this does exist. Please be safe, wear your mask, and be smart. Listen to the scientists.
Well, thank you for being with us today. You have a great holiday. Everyone have a great holiday. This is Lacey G with El Sol Latino.
Thank you.
Thank you, Ellie. Nice to meet you.
Nice to meet you.
We will never know how many friends and family didn't get COVID-19 because we followed safeguards. We'll never know that number. We'll never know how many lives we saved because we wear masks, wash our hands, and keep our distance. We'll never know exactly who we help when we take protective steps each day. We'll only know that we did all we could to save people from a dangerous pandemic. And that's a nice thing for us to live with. Together, we are beating COVID-19.
Para que los negocios sigan abiertos y puedas mantener tu trabajo.
Por lo que más quieras, mantén la distancia social.
Pensilvania se une contra el COVID.
Pagado con los fondos de los contribuyentes de Pensilvania.
Hazlo por los pequeños y por tus mayores, para que cuando todo pase, no falte nadie.
Por lo que más quieras, lávate las manos.
Pensilvania se une contra el COVID.
Pagado con los fondos de los contribuyentes de Pensilvania.